to ensure us that we have covered all the dollar obligations that we needed to do. So our payments delayed somewhat, and that is what is causing this particular challenge.
Meanwhile, the health minister has finally admitted he simply cannot tell when exactly the vaccines will arrive, except to say it may come in 2 or 3 weeks.
Honorable colleagues, let me be very honest. There are certain things or certain activities that are not controlled from the ministry. At the specific time frames that we put on, it will be very difficult for me to assure the House to do. So I come and stand here and tell you that Friday or Saturday, and things that are exogenous from the health ministry's environment that we don't control.
This is Top Story with Evans Mensah.
And Top Story is always brought to you by Vodafone. It was only on Tuesday the Health Minister, Ashaiman, who addressed a major news conference about the unprecedented shortage of childhood vaccines and insisted the problem was not because of a funding challenge.
On 29 June 2022, part transfer of funds to settle Ghana co-financing and cost of traditional vaccines and devices for 2022 from NHIA, 25 million Ghana cedis. On 7th October, for transfer of funds to UNICEF to settle Ghana's co-financing and cost of traditional vaccines, 10,750,000 Ghana cedi. 22nd November 2022, part settlement of GOG co-finance obligation traditional vaccines and devices, 30,111,000. 31st December 2022, when the year was coming to an end and we needed to ramp up our monies that NHIA should give us. We also did under transfer similar narrative, 23 million Ghana cedi. In all, we have a total of 71,861,000. How does it compare with 72 million? Apparently just about the same. And the irony of it is that that man has got this. I went there.
Well, last night he was grilled by members of parliament and forced to admit that indeed there was a funding challenge. He says payment for the vaccines delayed.
Now, last year, we didn't have adequate funding to be transferred into dollars to ensure us that we have covered all the dollar obligations that we needed to do. So our payments delayed somewhat, and that is what is causing this particular challenge.
And this was the exchange on the floor of Parliament that led to this admission.
Honourable Member for Teaching and North.
Thank you very much, Mr. Speaker, for the opportunity. Since the statement has become a question and has become an answer, I rise to ask the Minister for Health whether payments have been made for these vaccines. Thank you very much.
Honourable Minister.
Mr. Speaker, payments have been made for the vaccines that we are anticipating. We have paid for not less than 6 months vaccines to come. That will help us do that. Thank you, Mr. Speaker. Mr. Speaker, I want to ask the Health Minister, at what stock level do they do the ordering? At what stock level do you do age orders or reordering? And then also give us some information on the enormity of the matter at hand, or how have you assessed the situation now and how you are attaching some degree of importance to it.
Yes, Honourable Minister.
Mr. Speaker, the procurement process begins in October to carry us through 2023 to 2024, some part of the year, at least to the last quarter. So we begin our procurement process the last quarter of each year. We do our quantification, pass on to UNICEF. They also review our quantification. By close of December, we might have completed. We begin to make payments when we start working on these. Now, last year, we didn't have adequate funding to be transferred into dollars to ensure us that we have covered all the dollar obligations that we needed to do. So our payments delayed somewhat, And that is what is causing this particular challenge. As I speak, we have transferred for both co-funding obligation and the government-funded obligation in respect of all 2022. And even the government-funded obligation, the monies that we have transferred, like I said, will give us vaccines for not less than 6 months. And we are working very hard to take these vaccines in the country very soon. Mr. Speaker, in my answer to the question, I think I mentioned how seriously we are taking this concern and the type of things that we are putting in place to ensure that we don't have the outbreak getting to the entire country. That is what we are doing to make sure that we can all hold and contain the situation.
Well, we're also learning that government only placed orders for the vaccines just about a week ago. That was another significant admission by the health minister, as was grilled by the MPs. He was also questioned on when exactly the vaccines will arrive. Listen.
Per the answer given by the minister responsible for health, it was not clear. The Speaker, emergency health situations demand emergency solutions. The Speaker, as a house, we want to know when vaccines will be available in this house.
Very well. Honorable Minister, when will vaccines be available in the country?
Mr. Speaker, we are expecting to receive vaccines within 2 to 3 weeks. 2 to 3 weeks. We have done all necessary arrangements between 2 to 3 weeks. Honorable colleagues, let me be very honest with you. There are certain things or certain activities that are not controlled from the ministry when it comes to vaccine ordering, procurement, shipping, and all that. We have done the necessary things that we need to do. Placed our orders about a week ago, done all the necessary arrangements with the UNICEF people. They have given us indication. We don't know how quickly they're going to get air freight to come. We are pushing them to do. That is why I'm saying between 2 to 3 weeks. We are doing all things very possible to make sure that we even get some of these vaccines earlier. At the specific time frames that we put on will be very difficult for me to assure the House to do. So I come and stand here and tell you that Friday or Saturday, and things that are exogenous from the health ministry's environment that we don't control, challenges come in, we have problems. But I can give assurance that within 2 to 3 weeks, you will get vaccines to start our vaccinations with. Thank you.
Very well, Speaker. So within 2 to 3 weeks.
I want to bring in right now Kwame Sapana-Sedu, who is a CDD fellow responsible for health, also joining us tonight for a conversation as a ranking member on the Health Committee in Parliament. I'm also delighted that we can also speak tonight to a man with the expertise in this particular area. He is Professor Hassan Abdulmumin. He is a Pediatric Society of Ghana. He is with that society. And all gentlemen joins me on the telephone line right now. And very quickly, Kwame Sapana-Sedu, thanks for joining us via Zoom. There are two things we learned from the minister's questioning on the floor of Parliament. One, that he admits that the vaccines, we place the vaccines, he says, to use his words, just about a week ago. And then he also now says that apparently payments also delayed. Your reaction to that? Okay, I don't seem to have him on Zoom. If you can please unmute for me if you're there. Okay, let me bring in the ranking member on the Health Committee who joins us on the telephone line right now. Mr. Kando, I believe you're with me.
Yes, I'm ready.
Fantastic. So, I mean, those two things came as, a surprise to many, that he says there that we placed the order just about a week ago, but also now admits that he doesn't honestly know when it's going to come. 2 to 3 weeks, he says, because there are challenges. He can't really put his finger on. He can't tell it's Friday and we miss a deadline, but also that apparently payments are also delayed.
Yeah, that is true, Evans. And this is what I have been saying all along. Lack of forward planning. That is what it is. You don't wait till you find yourself in an emergency situation before you start looking for the solutions. In fact, even if they had started at the time we had the outbreak of the measles, probably by now would have had solutions to it. So obviously, they sat on concern aloof, and it has taken all of us by surprise. So I asked that specific question because I thought that at the end of those lengthy explanations and excuses, what we're all looking for is the availability of the vaccines in the country. So I asked specific question, and I didn't want to hear 2 weeks or 3 weeks. I wanted specific dates, but unfortunately, I insisted. But he told me that he would not be able to give me specific dates, but we should give him 2 to 3 weeks. And so, for me, I am not satisfied. But in Parliament, where the rules, once you ask a question, an answer is given. You can't debate the answer. So, my brother, the issue is about money issue. That is what it is. It's money issue. Because they took the money, they delayed in paying the money, and as far as they are concerned, the bad performance of the economy also contributed to this shortage. But of course, you cannot come and blame me for the poor performance of the economy whilst you had a solid team. You cannot come and blame me. In any case, when you took the money in the beginning of 2022, we all know that the dollar was around 6 Ghana cedis. Why didn't you pay the money at the time? Why didn't you? So as for the reasons they are giving us, for me, in my humble opinion, none makes sense. But of course, what we are looking for is a solution of the issue. What I'm looking for is that, look, we are taking delivery of vaccines and we are doing the distribution and then administering the vaccine. That is what is important at the moment. But from all aspects and the explanations we have heard, I don't think that they have any excuse at all, because this is not a new disease. We started fighting this thing as far back in 1977, and we have had plans. And you see, if you recall, at a point in time, they even said that there was shortage of the vaccines in the international market, which turned out to be false. In fact, the statement they referred to by the WHO, they were actually warning them to prevent this particular situation. And so there were excess of these vaccines in the international market, but they just sat down and didn't simply plan for the vaccines.
Mr. Kano, stay with me. Kwame Sapasiru is back on Zoom. Kwame, surprised to learn from the health minister when he was before Parliament that we just placed our order, he says, just about a week ago. Hello, Kwame. Please unmute for me. We'll try and rectify that. Because I need to hear from me. Professor Ahsan Abdul Mumin is with the Pediatric Society of Ghana, joins us, and he has been speaking today about what this has meant for our children across the country. And Prof, I was listening to you in that Zoom conference today, and there was something you said that I want you to clarify, if you may, that you possibly are recording some fatalities. Can you clarify that, please, for me?
Hello, and Ivan, good evening to you, and good evening to your audience as well. Thank you so much for having me. Yes, in my presentation, I was very careful in defining what we mean by a suspected case, what we mean by a confirmed case. And the only difference generally between what we said is confirmed and what is suspected is that for the suspected case, we do not actually have the laboratory results. And this having the laboratory results even is another issue that we will need to discuss, because this testing is centralized. And there are still cases that are pending since November last year that we do not have the results back from the testing laboratory. So when we said, we have 5 mortalities from the cases that we have been admitting since November.
So when you say cases, is it cases of...
Sorry?
Cases of these fatalities, they died because...
Yes, so we had 5 cases we admitted with suspected measles. And the suspected measles, they have all the features that you would document for a child or a patient that has measles. The only reason why we so call them suspected cases was that we do not have the laboratory results up to now. And since November, we have documented cases like that. So actually, we do have mortalities, even if they are not confirmed because the laboratory results is not available.
I mean, that is so important because both the president and the health minister, and Akando can bear witness to this on the floor, were very emphatic that so far they use the phrase, thank God we haven't experienced any fatality. But the Pediatric Society, you, on your records, you have suspected cases of children dying from that.
Definitely. I mean, definitely. And I repeat again that for me, this is not the first time I'm actually seeing cases of measles. I mean, many healthcare workers might not have seen for some time now. But I have been in Tamale for the last 12 years. And actually in 2013, we had another mini outbreak that, I was privileged to be around and manage those cases. So I know what a case of measles look like from the features that they present with. And the case definition leaves nothing for ambiguity. I mean, so when you see a suspected case of measles, you are only waiting to get the laboratory confirmation so that you can now say that this is a confirmed case of measles.
Do you have the laboratory? Do you have the laboratory results now?
So when they say they don't have, because they are saying that they do not have confirmed cases, yes, it's because the laboratory test is not there. But actually, we would have been happy that really we do not have any, cases of death. But we do have, although the labs, testing is not confirmed.
So the lab results for these suspected cases aren't in yet?
Yes.
As far as your expertise, your professional analysis of the cases are concerned, by the Pediatric Society of Ghana, these are suspected fatalities from measles.
Definitely, yes.
Okay. Mr. Kando, what's your reaction to this?
You see, that is highly unfortunate. Highly, highly unfortunate. And you see, what's the name of the gentleman on the other side, please? Hello?
Yes, I can hear you.
What is his name, please?
That's Professor Hassan Abdul Mumen of the Pediatric Society
of
Ghana.
Is bringing another angle, which is also very, very important. He's bringing another angle that even as we speak now, we have suspected cases since last year that we've not been able to confirm because the system, the laboratory system, is centralized.
Mr. Kano, so this is obviously one of the biggest challenges and many feared, and that we could now begin to see real
They were
deaths.
all talking in the attempt to water down the effect. They say, oh, thank God we have not recorded any death and what have you. It means that there are two issues here. It is either one of them or both. It means that they are not on top of the issues, or they are deliberately hiding the truth from us. That is what it means. And that is, any of them is very dangerous. Any is dangerous. And even if Prof will tell you, apart from even the fatalities and what have you, if you get it and it is not well managed, it has some permanent impairment. It affects the development of your brain. Sometimes some of them will be, in the case of the polio, you'll be crippled and all that. So even if you don't die, sometimes you will live with the effect throughout your lifetime. So if you begin to talk like this, you tell us that, look, you are not committed in handling the matter, and you just want to water down the effect of the situation. And so I'm lost of words. I do not know, and you can't get them to give you any definite date where we are going to have the vaccines. And so I think that we must begin to look at even the lab test. Where can we test these cases? Do we have laboratories in the northern part of the country? Where do they move? Where do they take these cases and all those things? We must begin to discuss it in total so that we don't get up to hear some of these things again. So it's clear. The minister and the president were not ambiguous. They were clear in their language that we've not recorded any death. So it means that they are not on top of the issues, or they are lying to us. That is what it means.
Let's see if we could get Kwame Sapansidu in with the CDD fellow there responsible for health. Prof is still with me. Kwame, if you can hear me, your reaction to the developments tonight, the minister admitting before Parliament that it's only last week that the orders were placed for the vaccines. The Pediatric Society of Ghana now confirming they have 5 suspected fatalities, 5 suspected cases dying from measles. Hello, Kwame. If you can unmute for me. Okay, definitely have a challenge with our Zoom connection there. Once we get Kwame on, hopefully this is fixed. We can hear his thoughts. But Prof, let me stay with you for a while longer. I wonder what is holding the confirmation of these cases. Why are the lab results not coming through as quickly as possible so that we can know what we are dealing with? And so, like, maybe now that we have 5 possible fatalities, it may trigger a bit more of urgency with dealing with this problem.
Yeah, so one of the things that we have been told, over the period is that there is an issue with reagents for the testing. And once the reagents are not available, the samples are sent, it takes, a very long time to get the results back. And the challenge is, it's not just like malaria or any other lab test that I can send my patient across the road to go and do in any other laboratory and bring the results back to me. This goes to a central laboratory. So all the samples that we get in northern region goes to one laboratory in Accra. And then we then have to wait for the testing to be done. The results are sent through a software. Every day we check the software with the public health team to see if the results for our patients are back. Today we did the same thing. We still don't have the results. And this is important because if we are saying that it's suspected, it means that this condition could have been something else. And either way, it is a problem because even if it's not measles and it's another condition, we have not seen this in a very long time because we have, I've been in these hospitals, I've been working around here. We've not seen children with that much rash. So assuming without admitting that even we are thinking these rashes are due to other maybe medical conditions, we still need to confirm because in that case, we might be dealing with something that is new and that way we will need to find a solution to it. So, either way, we need to get the results back. And then if I had my own ways, I could have maybe even taken a definite sample and then test all of them with a standard laboratory so that I will be able to communicate to communicate with stakeholders that we have, this is the result that we have for most of these patients who are coming to the hospital.
Prof, stay with me. Kwame Sapansidu joins us on the phone now. Kwame, what's your response and reaction to what we're learning tonight from the Ghana Pediatric Society, but also from the Health Minister in Parliament?
Evans, the first thing I would say is thank you, but the question I ask is, why is that minister still at post? This is a minister who, even I, who doesn't sit in government, knew. And for some of you who I was having private conversations with, knew that I knew they hadn't paid for the vaccines. And I had even insinuated that they hadn't paid for the vaccines on the Super Morning Show. And with you on Newsnight by saying, we don't know, because I wanted to be open-ended. So I was surprised when the minister stood up and gave that press conference and didn't admit, without even realizing, that his own account of the transfers pointed to the fact that there were variations in the CD-dollar exchange rate. Now we are learning from the Pediatric Society that there possibly could be some mortalities. And I'm using possibly advisedly because as a biomedical scientist, I know that a clinician, a professor who has practiced this long, knowing the case definition, is most likely certain, but we err on the side of caution because even when you have the result, normally you would want a result for a confirmatory result from a reference lab like Prof said. So I am erring. But if it turns out that anybody has passed away and the president was misled to come into parliament when people like Prof knew that there most likely could have been mortalities, and he also, in a House of Records, told an untruth because he hadn't been briefed properly, then I'd ask myself, why is the minister still at post? The minister said in Parliament, because I've been listening from the start, that he was being honest with the parliamentarians, that there were things that were beyond his purview, because when it comes to the transfer of funds, it's not down to the Minister of Health. Why couldn't he tell the Ghanaian then, when he was holding his press conference with Kojo Nkrumah? Why is it that it took some of us to start unpicking the statement he made before he got to the point where he would raise his hands and tell the truth? For me, if you're giving stewardship of this country and you tell us untruths, you should walk. And therefore, at this point, I think the minister should walk. That is my reaction.
But the challenge, yes, is he should walk. And except that their lives are at stake. We know the president's posture on these matters is to defend his ministers. For these children who, as we now hearing from the Ghana Pediatric Society, are in real peril, possibly 5 already dead, sacking him tomorrow won't fix the problem, right? I mean, and now he also admits it's just about last week that the orders were placed, and so it's just anybody's guess when this will come. And honestly, he said today, I can't tell Parliament when. Are there any alternatives? Are there any alternatives?
Evans, if you remember on Newsnight, I told you the way the supply chain works. And the fact that this year, because there was a global decline in the measles vaccine uptake, and last year there was an excess, like Akando said, a lot of the manufacturers like Biological E and Serum Institute didn't add an overage to their production. So to get vaccines becomes very tricky. Even the manufacturers cannot guarantee the timeline to Gavi and UNICEF. And that is why the minister cannot give a firm timeline. It's got nothing to do with air freight. It's got to do with the supply chain and the dynamics in it. And I get really, really disappointed. It's not about getting rid of him who fix the problem. It's about the optics, which tells us that in this country called Ghana, in this republic, when you mess us up and you are not truthful to us after messing us up, or you try to cover up for other people who have held the money, because the NHIS money has to go directly to the NHIS. If the minister, my finance is the one holding it, own up to Ghanaians. It's the responsibility of Ghanaians to get angry with him. If you take the fall, then you have to fall on your sword. So it's not about him being the fix for the problem because sacking him would resurrect the children. That's not what I'm talking about. It is about accountability. He hasn't been accountable to us, and he must walk.
Prof, let me ask you, because of how urgent this is, and you record 5 fatalities possibly from measles. Anybody's guess it could be more. We hope it's not. Is there any other alternative that could help parents currently, possibly? And I heard you also in that conference today detailing the number of cases currently on admission and children who are suffering from measles, and the possibility that it may be spreading even more. Is there any other alternative in the meantime for these parents? Hello, Prof. Hello, Professor Hassan. Do we still have Professor Hassan on? Let's get Professor Hassan back, because I need to get him to hopefully, talk to parents about what they could do to mitigate any further challenges to the health of their children in the midst of this crisis. Hello, Prof.
Yes, Ivan.
Yes, Professor.
I can hear you now.
For parents who are listening to you right now, who possibly also have the same challenge, they see their babies not well. They've been told your child has measles. They've heard you say they possibly have 5 deaths now. What can they do to mitigate? Is there any other alternative?
Ivan, there are a number of things that we can do in this situation, because it appears that we are not sure when this wait is going to end. Because I have said in a number of my conversations that if the vaccines were available today, what we can do is for all children who are between 6 and 9 months. The first vaccine dose for measles is at 9 months. But when you have an outbreak situation, so those who are between 6 and 9 months, we could actually ramp up the vaccination and vaccinate all of them, including those who may be exposed to households of children or adults with measles. But then we do not have the vaccines as we speak now in most places in Ghana. So what we advise families to do is, if your child already, have a rash, which generally appears from the head and then it spreads across the whole body, then they have a fever, then you will need them to be evaluated, because apart from just the rash and the fever, they can actually develop complications. So if a healthcare worker evaluates this child and is sure that the child only is having fever and the rash with cough, but do not have the serious complications, these are children that we can keep at home, and then the parents can manage them by giving them medications to control the temperature. But for those that will have complications, like they have breathing problems, a number of them do come with convulsions, or they will be running diarrhea up to the extent that they lose so much body water. Then we need to admit all those children. So if your child do have, these features that we have discussed, so fever, cough, and then the general rash, they will first of all need to be evaluated by a healthcare professional. If we are sure that they are not the severe type and they are mild measles, then those can be managed at home with supportive care. For those whose children already do not have signs of measles, we advise that, those who are less than 6 months, families should continue to breastfeed, because breastfeeding might be old, but it's still good. And it's so important in boosting the immunity of all children, especially if your nutrition and immunity are both very good. Your chances of getting measles is low. So they have to continue to breastfeed. And then we need to continue to observe hand hygiene. This is very important, because this disease that we are talking about, and many of the diseases that the vaccines prevent against, actually are spread from contact, or maybe cough, and then the germ will spread into the air. So families would need to observe very strict hand hygiene, wash hands before and after, daily chores, and then make sure that their children are, protected from getting the disease in the first place.
Prof, thank you very much. This is possibly very helpful, very life-saving possible for parents who are listening tonight, who may be experiencing this. Kwame Sapasiru is with me on the telephone line. Kwame, last words for you on a night like this, to learn that 5 babies dead already due to suspected measles infection. Prof has helped with some interventions parents could be practicing tonight to prevent further fatalities. You calling for the minister to go. From everything I've heard tonight, it doesn't appear that as far as the vaccines are concerned, we can get it in anytime soon. The parliament has some authority also in this as well. If the president doesn't, we saw what they did with the finance minister. At least they're triggering their own internal processes for a vote of censure. You think it's time for that for the health minister as well?
Our parliament was up and doing, and if we could get bipartisan consensus, yes, I would think that parliament should trigger actions to get rid of him. The truth of the matter is, though we have a finely balanced parliament, we do not have bipartisan consensus, so that route wouldn't work. But I think it's time for civil society to rather start calling the minister out and put pressure on the parliamentarians to do what is right by us. Because at the end of the day, we are dealing with a governance architecture where, if we are not careful, it would become okay to lie to the general public at press conferences and only try to be truthful when you are in parliament because it's a house of records. The minute that happens and we condone it, trust in our democracy, the last bit that is left of it, might even break down. And when that happens, it wouldn't augur well for all of us. So if I was to advise Parliament, I'd say yes, they should trigger processes to get rid of the minister, especially when he looked them in the face and said, let me be honest with you. So he was acknowledging to them that he hadn't been honest with the rest of us. And that for me is key. Let those who have ears hear us out.
Well, Mr. Pansidu, thank you very much. And earlier you had a consulting pediatrician at the Tamale Teaching Hospital. He's the Northern Regional Chairperson of the Pediatric Society of Ghana. And if you're just joining us tonight, a major development in our nationwide unprecedented shortage of childhood vaccines. The Ghana Pediatric Society reporting tonight that 5 babies are dead due to suspected measles infection following outbreak of the childhood killer disease aggravated by this unprecedented nationwide shortage of the childhood vaccines. The cases have now been sent to the labs, waiting for the lab results to come in. But the pediatrician saying the cases present all the symptoms of measles, and these fatalities they firmly suspect is as a result of the measles outbreak. That is the major developing story today, on the day when we learned from the health minister is several admissions. One that finally admitting that the unprecedented nationwide shortage of the vaccines was down primarily to funding challenges. He says the funding delayed. They paid for the vaccines late. In fact, he also puts a timeline to this now. He says they only, just about last week, placed the orders for the vaccines. And he cannot tell when the vaccines will come. He says he's been honest with the members of parliament. I want to hear from you on this on Newsnight, especially if you're a parent with a baby and worried. You've heard the pediatrician give some advice, what you can do in the meantime while we wait for the vaccines to arrive. 055-1111-997 here on Newsnight. We are transiting into Ghana Connect pretty shortly. Stay with me.
Make you give me correct shock absorber. Or make I do video concept then take the Gaussian P for the engine show you.
Every morning you the tear calls, they browse. Actually, something they get.
Hey, Tago, the way town make hot. And Robert so and if it be you where you get Vodafone 1 Ghana promo them out 20 minutes talk time to call all networks where you start get data and 1 gig from 5 a.m. to 11:59 a.m. Bye. Anka you go do pass me safe Ankasa. You dial *530# make we enjoy. You go fit subscribe as many times as you want.
Yes, plantain.
Yo, sweet Ama, take this by Vodafone 1 Ghana bundle. Moku vibe plus video calls and taste. You catch the vibe. Early morning, 5 a.m.
All grown up, innit? So good to see you, fam. I miss you so much. So good to be back home, bruv. Innit? I can see a lot has changed, mate. Home sweet home, innit?
Sit down and let me serve you something delicious.
The food is looking good, fam.
Of course, some things never change, just like